Imagine being told by your doctor that you're being treated for your illness, year after year, decade after decade. You trust him. He's kind to you. He gives you free meals, free rides to the clinic, even a small payment for your time. What he doesn't tell you is that there is no treatment. There never was. You are not a patient. You are a subject in an experiment, and the doctors studying you are simply waiting to see how your disease kills you. This isn't a horror movie. This happened in the United States to American citizens for 40 years, and it was called the Tuskegee Syphilis Study. To understand how something like this could happen, we need to go back to 1932 in Macon County, Alabama. The U.S. Public Health Service, working with the Tuskegee Institute, launched a study officially named the Tuskegee Study of Untreated Syphilis in the Negro Male. The plan was to recruit around 600 black men from one of the poorest counties in the country. About 400 of them already had syphilis. The other 200 did not, and they were used as a comparison group. The stated goal of the study was to observe the natural progression of untreated syphilis in black men, from infection all the way to death, and to see if the disease behaved differently in black patients than it did in white patients, a racist assumption already baked into the research itself. Here's the part that makes this so disturbing. The men were never told they had syphilis. Instead, researchers told them they were being treated for bad blood, a vague local term used at the time to describe a range of ailments, including fatigue and anemia. They were promised free medical exams, free meals, and free burial insurance, an incentive that mattered enormously to poor sharecroppers who often couldn't afford a proper funeral. In exchange, these men were monitored for decades. They underwent painful spinal taps, described to them as special free treatment, when in reality, those procedures were being used purely to study how the disease was progressing in their bodies. Nobody explained the real diagnosis.
Nobody explained the real risks. Nobody explained that they were part of an experiment at all. The most damning part of this story is what happened once an actual cure became available. In the early 1940s, penicillin emerged as a highly effective treatment for syphilis, and by the end of the decade, it had become the standard treatment nationwide. Here was a moment where the researchers could have stopped everything, treated the men, and ended the study. Instead, they did the opposite. The Public Health Service made active efforts to prevent these men from receiving penicillin. They worked with local doctors and draft boards to make sure the participants were excluded from treatment programs that could have cured them, going so far as providing lists of the men's names specifically so that other doctors wouldn't accidentally treat them and ruin the experiment. The researchers weren't just passively allowing suffering to continue, they were actively intervening to make sure it did. It's also worth knowing that Tuskegee wasn't an isolated incident born from one uniquely bad decision. One of the doctors most closely associated with the study, John Cutler, had actually been involved years earlier in an even more aggressive set of experiments, this time in Guatemala. Between 1946 and 1948, working with the Guatemalan government, Cutler helped run a program in which American researchers deliberately infected prisoners, soldiers, and patients in psychiatric hospitals with syphilis and gonorrhea without their knowledge or consent, specifically to test whether penicillin could prevent infection after exposure. Roughly 1,500 people were exposed to these diseases as part of that program. This history stayed completely hidden for over 60 years until a researcher uncovered Cutler's personal files in an archive in 2005, and the U.S. government didn't formally acknowledge and apologize for the Guatemala experiments until 2010. The fact that the same researcher moved from deliberately infecting people abroad to withholding treatment from people at home says something important about how normalized this kind of thinking had become within parts of American public health research during that era. For the men in the study, the consequences were devastating.
Untreated syphilis doesn't just go away. It progresses through stages, and if left alone long enough, it can cause severe cardiovascular damage, blindness, insanity, and death. Some of the men in the study developed serious complications from the disease. Some infected their wives, who in turn had children born with congenital syphilis. Estimates suggest that by the time the study ended, dozens of the men had died directly from syphilis or its complications, and dozens more of their wives and children had been infected as an indirect result, none of them ever informed of what was actually happening or why. The study continued for 40 years, from 1932 all the way to 1972, 4 decades. Multiple generations of researchers cycled through the Public Health Service during that time, and remarkably, very few of them ever raised serious objections. Papers about the study were published openly in medical journals throughout the years. This wasn't some deeply buried secret hidden in a locked government vault. It was, in a sense, hiding in plain sight, discussed at medical conferences and referenced in scientific literature, largely ignored by the broader public because the men affected were poor, black, and largely without a political voice. The person credited with finally exposing the study to the public was a Public Health Service employee named Peter Buxton. Buxton had joined the agency as a venereal disease investigator in the mid-1960s, and after learning about the Tuskegee study, he became increasingly disturbed by what he read. He raised formal objections internally in 1966 and again in 1968, arguing on both medical and ethical grounds that the study needed to stop. Both times, a committee within the Public Health Service reviewed his objections and decided the study should continue. Frustrated after years of being ignored internally, Buxton eventually took his concerns to a journalist. In July of 1972, reporter Jean Heller broke the story publicly, and the resulting media coverage caused immediate national outrage. Once the story became public knowledge, the government could no longer defend the study, and it was shut down almost immediately. A federal panel was convened to investigate what had happened, and its conclusions were damning. The panel found that the study was, in their words, ethically unjustified, noting that the knowledge gained was minimal compared to the risks imposed on the participants, and that these men had never given anything resembling informed consent. Out of this investigation came the National Research Act of 1974, which established the modern system of institutional review boards that now oversee human research in the United States, along with formal requirements for informed consent in virtually all federally funded medical studies. In many ways, the entire modern framework of research ethics in America exists specifically because of what happened in Tuskegee. But for the men who survived the study and the families who lost loved ones to it, official reforms and new regulations didn't undo the damage. A class action lawsuit was filed on behalf of the study's participants, eventually resulting in a settlement of about $10 million, along with a commitment from the government to provide free medical and burial services to the surviving men and their affected family members. It would take over 2 decades more before an American president formally apologized. In 1997, President Bill Clinton stood in the East Room of the White House and delivered a formal apology on behalf of the United States government to the 8 remaining survivors of the study, acknowledging that what had been done to them was deeply, profoundly wrong. What makes the Tuskegee study such an important and uncomfortable piece of American history isn't just the specific details of what happened, though those are horrifying enough on their own. It's what the study reveals about how systems of power can dehumanize people who are already vulnerable. The men chosen for this study weren't picked at random. They were chosen because they were poor, because they were black, and because in the segregated South of the 1930s, there was little chance that anyone in power would ever be held accountable for what was done to them. The scientists and doctors who ran and maintained this study for 40 years weren't cartoonish villains twirling mustaches. Many of them likely saw themselves as serious medical professionals contributing to scientific knowledge.
And that might be the most unsettling part of the entire story. It shows how ordinary people, operating inside a system that dehumanizes certain groups, can participate in something monstrous while telling themselves they're simply doing their jobs. The legacy of Tuskegee extends far beyond the history books. For decades afterward, deep mistrust of the American medical system persisted within many black communities, mistrust that researchers and public health officials have had to actively work to address ever since, particularly during public health crises, when trust between doctors and patients becomes a matter of life and death. When you hear about vaccine hesitancy or reluctance to participate in clinical trials within certain communities today, the shadow of Tuskegee is often part of that conversation, whether people explicitly reference it or not. This is a study that ended in 1972, but its consequences rippled forward for generations, shaping how millions of Americans relate to their own healthcare system. So, what do we take away from all of this? The Tuskegee Syphilis Study forces us to confront an uncomfortable truth. Unethical behavior in science and medicine doesn't usually announce itself with obvious villains and dramatic warning signs. It creeps in slowly, justified one small rationalization at a time, especially when the people being harmed are already marginalized and have little power to push back. It took 4 decades, a committed whistleblower and a courageous journalist willing to publish an uncomfortable story before this experiment finally ended. And even then, justice arrived far too late for the men who had already died, and far too late for the families who had already lost everything. Tuskegee remains one of the starkest reminders in American history of what can happen when scientific curiosity is allowed to operate without real oversight, without informed consent, and without any regard for the basic humanity of the people involved. It's a story about race, power, and medicine in America, and it's a story that still shapes how this country thinks about ethics in science today.